My colleague Nick Babaya, who's a researcher, will now be introducing 10 policy recommendations, proposals made by the IRR, mostly drawn from the 97-page document Dr. Cronje mentioned at the very start, but also newer proposals that have been developed in succeeding days and will form part of the IRR's policy recommendation output files or output attempts in coming weeks. That being said, Nick, floor is yours.
All right, thank you very much, everyone, for being here. As Herman already said, if you have any questions, you can put it in the chat box. Just to mention once again, most of the proposals which I'm now about to talk about come from the IRR's report. You can see a picture of it there on the right-hand side. It's really a fantastic document with input from all the greatest minds of the Institute of Race Relations, so I highly encourage you to go and have a look. All right, so to start things off, the emergency COVID-19 treatment vouchers. The idea for this is to understand that scarcity is going to be an enormous problem when this pandemic in South Africa really hits a crisis point. We already have a number of problems documented by the IRR and the public health system. So we have put forward a proposal to give private healthcare vouchers for people who are particularly vulnerable to COVID-19 or people who are in difficult financial situations. Just to give a brief overview, the way this would work is that you'd have to, first of all, the vouchers would be given directly to hospitals, and there would simply be a payment route that would go straight to the Treasury or some other relevant government department. In order to fulfill the criteria to use one of these vouchers, you would have to pass two criteria. The first is that you test positive for the coronavirus, the novel coronavirus. And the second is that you fulfill one of a number of criteria which designates you as what we would call somebody who's particularly vulnerable to COVID-19. This could be someone with suppressed immune system, a chronic respiratory disease, somebody who's particularly elderly, or somebody who's particularly poor, perhaps. The isolated care vouchers, likewise, there are many people living in informal settlements in South Africa and other living situations, which makes it very difficult for them to self-isolate. Similar to the voucher system from hospitals, seeing as hotels and other places of accommodation, which make their money largely from tourism, we suggest giving vouchers to these places of accommodation. And the idea here is that if your living situation is not conducive to self-isolation, you can go to one of these places of accommodation and stay there, almost like as a safe haven where you can self-isolate. And then converting public infrastructure to temporary medical facilities. This has been done in a number of countries around the world, places like halls, school halls, university residences, even stadia they were doing in the UK, I saw recently. And the idea here is that, the government owns these places already, so they won't have to jump through any hoops to use them. And the idea, we can use these facilities if they're converted to medical facilities, really for cases where patients have a serious case of COVID-19, but not so serious that they require intensive care. Of course, if you do need to be in ICU and be on a ventilator, then you should probably go to a hospital. Accessing UIF funds, we anticipate that there will be probably many, many millions of South Africans who could be put off work either through retrenchments or being put on unpaid leave. In cases like this, we would simply say that these workers should go onto UIF in order to maintain cash flow. Again, this is part of the whole objective of trying to lessen the economic impact of the virus. Encouraging banks to renegotiate debt repayment plans. Of course, we wouldn't want to force any banks to do anything. I think the consequences of making financial institutions do things which are totally against their balance sheet is extremely unwise. But we are very happy and we endorse that it seems like a lot of banks in the private sector have actually come to the forum and in goodwill have said, okay, we're going to be nice and allow our customers to renegotiate debt repayment policies. It's actually to the benefit of banks in any case, because a whole number of clients defaulting on their debt would not be good either. Then on the tax holiday advice, this one is slightly technical. I'll just explain it. So it comes out of Australia, the idea. Normally, if you have a certain amount of money which you would contribute to a monthly annuity, such as a pension fund or something like that, that would get removed from your taxable income. We would like to propose that people who would instead keep that money for their own use in cash do not get that added to their taxable income. Rather, the tax exemption still remains, and that can be left in place for the forthcoming financial year, or otherwise, depending on the situation of the virus. The use of military logistics. Of course, the military are currently on our streets assisting the police. We haven't quite reached state of emergency yet, but they are doing law enforcement jobs. But the military also has a lot of logistics of its own. It owns a lot of vehicles. And we think these could be good use to use these vehicles to deliver things like food and medicine to people in certain communities. The idea here is also just to lessen the need for people to leave their residences. We also came up with the idea of the Emergency Citizen Volunteer Service, and this is an interesting idea. I think the idea here is to create a volunteer service for citizens, perhaps citizens who think they're quite healthy or those who have already recovered from the virus, who actually want to go volunteer to distribute things like food and medicine to perhaps poorer communities or informal settlements. And the idea here is that people would get kitted out with all the right protection kit, face masks, and the right medical equipment. And then people could actually volunteer and just lend their manpower to helping the situation. Yes, and this is also a suggestion which comes out of Germany. The idea is that if we exempt people who have already recovered from COVID-19 by doing antibody testing, we should allow them then to rejoin society, start work, be able to go outside, etc., etc. I think the important thing about something like this is that we want to emphasize that one of the most important things that we have here is that people get back to their normal lives as soon as possible. This lockdown is extremely disruptive. So anything that can allow people to return to their daily lives as normal would be fantastic. And then, with the lockdown comes a lot of new regulations, which the government has gazetted. There's been a bit of, not so much clarity about this. Government should simply publish simple language versions of all regulations related to the lockdown. No legalese, nothing confusing, just put it in plain language so that there's broad understanding. And to that end, law enforcement should also be educated on the regulations. In this time, law enforcement, we've already been seeing videos of some aspects of police brutality, and it's brought concern to us. And the fact is that the regulations are only good as the enforcement which enforces it. So it's vitally important that the police and the military also understand exactly who can and who can't go outside. Thank you very much. That's all from me.